A 40-year-old male presents to the clinic for a wellness visit. He complains of a persistently runny nose and cough over the last 3 months. Last week, he noticed an intermittent cough that produced small specks of red-tinged sputum. He notes shortness of breath and weight loss. Since yesterday, he has had brownish urine. He has never smoked and is a social drinker. He is sexually active with his wife and denies any other sexual partners for the past 9 years. Take a second, check out the answer choices, make your pick, and we'll go through the choices. All right, vasculitis questions are tough. You can deep dive into an hour-long discussion about histology, C-ANCA, P-ANCA, not high yield for levels 2 and 3. The way I would approach this is look at organ system involvement and a few key risk factors. So let's go through each of these question choices and start with the easiest ones to eliminate. Choice A, Berger disease, wrong. We're talking about IgA glomerulonephropathy. IgA antibodies deposit into the renal mesangium. We're not going to do the step 1 pathophysiology discussion, though. It's just not helpful. It's easy to eliminate because, one, the stem has to mention a recent upper respiratory illness or GI infection. That's not mentioned here. Second, for Berger's disease to be correct, the patient should have mild symptoms, no complaints except for isolated and intermittent tea-colored urine, usually in a young, healthy male. In our case, we're looking at a 40-year-old patient with pulmonary involvement. Berger's disease is easy to eliminate. If you were dealing with a Berger disease question, it's important to know that supportive treatment, blood pressure control is the first-line therapy. ACE inhibitors and SGLT2 inhibitors both reduce proteinuria and slow the decline of kidney function. They would be appropriate medications to start. Let's jump to choice D, polyarteritis nodosa. Wrong answer. Very easy to eliminate. Why? In PAN, lungs are spared. Our patient has hemoptysis. Secondly, this is generally an easy one. The stem needs to mention hepatitis B, or they can tell you he's promiscuous or an IV drug abuser and expect you to infer that hepatitis B infection could be from this lifestyle. Our question goes out of its way to mention long-standing monogamous relationship. All right, so for PAN to be correct, there needs to be hepatitis B, no lung involvement, constitutional symptoms of fever, weight loss, abdominal pain. Treatment would be high-dose steroids. Choice D is not correct here. Okay, so we're left with B, C, and D, and this is where it gets harder. These choices are pulmonary renal syndromes with similar patient presentations. Let's look at Goodpasture syndrome, choice B. That's wrong. For Goodpasture to be correct, it will be hemoptysis and renal failure in isolation. Period. No upper airway involvement, no fever, no arthralgia, no purpura, no constitutional symptoms. Our patient has constitutional symptoms, weight loss. So you know it's wrong. You can stop reading. If it were Goodpastures, you'd look for two things: rapidly progressing renal failure and hemoptysis. No other symptoms. Treatment for Goodpasture would be plasmapheresis and corticosteroids. It's the only option choice that involves plasmapheresis as a treatment option. Choice B, Goodpasture syndrome, wrong answer. All right. Microscopic necrotizing polyarteritis, choice C. That is the wrong choice. It's wrong because in the stem, the patient has nasopharyngeal involvement, and microscopic necrotizing polyarteritis does not have nasopharyngeal involvement. That's why I'm making this question. Our patient has a runny nose, which is a symptom of sinusitis. If we're looking at microscopic necrotizing polyarteritis, look for someone with palpable purpura or skin involvement, systemic features like fever, weight loss, arthralgia. So the right choice is granulomatosis with polyangiitis, choice E. If they mention sinonasal involvement, nasal perforation, epistaxis, or yes, even runny nose like sinusitis, GPA is the primary condition that presents with prominent upper respiratory conditions as well as nasosinus symptoms. That's this case. Other conditions, good pastures, microscopic polyangiitis, typically lack these specific upper airway features. Treatment in this case for GPA is high dose corticosteroids. That's it. Hope it helps. Thanks for listening.